And that's where we come to more recent studies, especially these neurotoxin studies. This is something that was not, of course, investigated in the 30s or 40s. The notion of, neuroscience itself was barely developed. Now, my view of this is that these are very important studies. They are not yet robust enough, and they're not yet enough of them to necessarily sort of clinch the evidence of a neurotoxic effect at this level, but they are indicative of what we would expect fluoride to do, is to have these kind of subtle effects on brains, on organs, on kidneys, whatever, over time, that it would do this. In this case, it's infants, right? They're studying infants and pregnant mothers, and they're discovering that there seems to be a pretty high correlation between IQ diminution and fluoride consumption in water. So that is fairly compelling evidence at this stage. I think, more studies will be conducted. So I think where we are at right now is a situation that it's hard to know exactly what happened in the 50s and 60s, because the data they collected was almost certainly contaminated by their own kind of bias towards fluoridation. So that's, I think, where we're at now in terms of the debate, and that's what I would like to do. I'm going to, in the next few months, I'll probably try and write an op-ed piece for the Times, which they'll hopefully publish, where I can sort of make that sort of case. It's like, okay, let's start with where we are now. Let's have the debate based on the conditions that exist right now. Let's forget about the past. The past is contaminated by all these other things which I've talked about, which give us a false sense of what fluoride was actually doing. And let's instead start with the data we have.